Here's something they don't teach you about stab wounds in paramedic school, with a real world example at the end from my own practice. So I think when you're managing someone who's been stabbed, it can be quite easy to become distracted by the aggressive, nasty stab wound that's in front of you, and subsequently can result in you losing track of your primary survey and not adequately assessing other body systems that might be involved. But I think one of the things that has to be at the forefront of your mind is you cannot predict the direction of the knife once it's been inserted inside of the body, and that was certainly a prevalent factor in a case I attended many years ago, which I'm going to talk about in a minute. But before I do, these are exactly the sort of topics I discuss in the trauma book linked to my bio. So if you want to learn a little bit more about trauma, and if you're a healthcare student or professional, be sure to check it out. So I attended a patient who'd been stabbed in the lower abdomen, and whilst they had significant abdominal trauma, I noticed that surgical emphysema was present when I initially assessed the patient. So we thoroughly examined the patient's chest, and it turns out they actually had significantly reduced air entry in the lower lobes on one side of their chest, and imaging at hospital revealed that whilst the knife had been inserted into the lower abdomen, it had been thrust upwards and penetrated the diaphragm and resulted in a pneumothorax.